My name is Tyler Leete, and I'm a radiologist specializing in breast imaging at CHRISTUS Trinity Clinic. I grew up just north of Dallas and moved around in several of the suburbs there. I had a very comfortable but very modest upbringing, and it was great. I think, in retrospect, I didn't want for anything, but it taught me a lot of good values. And my parents worked very hard to provide a nice, comfortable life for my sister and myself. Definitely my parents. So they really, when I was young, didn't have a lot and kind of moved away from their families early on in their lives and made their own lives. And I saw early on how hard you have to work to really succeed in life and to advance yourself in life. And they always wanted nothing more than to provide my sister and I with better lives than they had themselves. And so that's definitely become a goal of mine in life. And I thank them for instilling those values in me. I actually had an aha moment when I was a sophomore in high school. And after a particularly interesting day in biology class, actually dissecting frogs, I knew instantly this is what I want to do. So I went home that day. I told my mom I'm going to be a doctor, and she said that's great, and I never turned back. Radiology in general, I was attracted to it because of all of the innovative technologies and a lot of the science behind it, but then also I was drawn particularly to breast imaging within radiology because of the human contact, and I just think it's a great combination of science and medicine, but also just human nature and being able to care and nurture people and provide them with the compassion that they need in really trying times. I decided within radiology that I wanted to become very specialized. And with all the new technologies and all the advancing techniques and with more and more research, it's just becoming more and more difficult to be an expert at everything. And so I made a conscious decision to focus solely on breast imaging because my philosophy is that I feel it's my duty and my responsibility to be the absolute best breast radiologist that I can be. And by doing that 100% of my time, I'm able to stay up on the research, stay up on new technologies, new techniques, and really provide the best care I can for my patients. And combining that with the human side of it, the compassion, and just caring for the person while providing the best possible medical care, that's really just the core of what I feel my role is.